Hello, and welcome back to Authentically Shawna. I'm your host, Dr. Shawna Burke. I am so excited to have Oliver Hartan join me for part two of our discussion. If you missed part one, I highly recommend going back. You're going to have to go back a little ways. Oliver joined me in episode 4. So pause, go back, listen to it, and then come back and join us for part two of our discussion. Oliver Hartan is a Canadian massage therapist, which we talk about different thing than in America. He is a certified Matrix Repatterning Practitioner, is a lead instructor for the Matrix Institute, and also sits on the Board of Education for the Matrix Institute. Welcome back, Oliver.
Thank you for having me. It's great to be back.
So, one of the things that I so appreciate about you as an instructor is I feel like you're so good at explaining to people what normal is versus not normal. And I wanted to really take a deep dive into that because that's been such great feedback that I've been getting from other guests that I've had on is okay, when I go see someone, when they ask me, is it normal? I don't even know how to ask or answer that question because no one has given me a framework for what normal is. So I wanted to start out. And so if you're driving, this might be a time to like pause and come back to when you're not driving because we're going to do a little like hands on our own bodies and feel what normal tissue feels like so that when you go and see a massage therapist, a physical therapist, a chiropractor, whatever body worker, whoever is going to be doing an assessment on you, you have a good understanding and appreciation for what your own tissue feels like. So let's start out with the layer that most of us can touch pretty easily, which is muscle. So, Oliver, can you walk us through what normal muscle tissue feels like?
Yeah, for sure. Well, I mean, normal muscle tissue, it's not rigid, it's not stiff, but it's also not totally slack at the same time. So it's this kind of quiet readiness that your muscles are performing. And this baseline firmness, you could say, in a healthy state is exactly what you want them to be. And if you press on it, like if you press on your thigh right now, or if you
Yeah, let's
press
do the
on,
quad. Let's
yeah,
do the
okay.
quad.
Okay. Yeah, so if you're seated in a nice comfortable position with your feet flat on the floor and just with the palm of your hand you press down into your quad, what you're going to feel is kind of like a gentle relaxed resistance, like a soft spring that gives a little bit but pushes back just enough. So it's not doughy or mushy, and it's also not hard like a rock. If it is hard like a rock, you've got some what's called hypertonicity. It's like really rigid. Maybe you got some muscle knots in there, some adhesions to the tissue. If it's doughy or mushy, then the muscle belly or number of muscles in that region are under firing, and so we would call that hypotonicity. And you want to be, yeah, right in the middle, so that sweet spot.
So I hear this a lot, and I'm sure you do too, is people come in, they say, oh my gosh, my muscles are so tight. I feel like I hear this all the time. I'm sure you do too. My hamstrings are so tight. What do you think people are perceiving versus what their actual muscle is doing?
Well, you can have kind of like a lengthened muscle that's tight, long and tight, or short or tight. You can have like a contracted muscle that it feels tight. It's kind of rigidified, and so I mean the feeling can be a little bit misleading, and it's useful to identify really just the baseline tone, figure out if it's really tight or mushy, so low tone, and then figure out what's contributing to that. I guess you could think of it as a stress or a heightened sense of tightness or an instability, so a mushiness. And so you just want to look for what's contributing to the heightened sense of tension or the weakness or mushiness.
Which Matrix says so well. So I'm going to put a pin in that because we're going to make a full circle. We're going to come back to that thought. So the second tissue or type of, yeah, tissue is a bone. Like what do bones feel like? Because I think we forget that bones can change, that bones have blood supply, they have nerve supply running through them. Like what does a normal bone feel like?
Yeah, I mean, when we're feeling our bone, like if we tap on our shin bone, the tibia there, I mean, there's distinct solidness to it. It's pretty firm feeling. It's not gonna give like a muscle does. A muscle's got this subtle springiness to it. Bone is quite unyielding, hard and dense. But I will say this, and Dr. Roth, the founder of Matrix Repatterning, talks about how bone is very much alive and bendy, and it is capable of absorbing forces of like twist or strain or impact, and it's malleable. So there's a certain amount of flex to the bone, and you may have experienced this yourself if you've ever had a bit of a like a leg torque or twist and it felt like your whole bone like a green stick, you know, you just bent the stick in the forest,
Sure. Yeah.
but it didn't fully break. That, you know, the bone has some give, but when you're feeling it with your fingers, it doesn't feel like it gives too much. I mean, normal bone feels like that. I can't really speak to cancerous bone or other things like that, but in terms of what you'll feel across the board in most cases, it's this firmness, this hard, dense sensation.
And I'll say, just from coming and learning with you, is that when I was palpating or touching bone, a shin bone, for example, and you would have us compare right to left on most of us who we'd consider ourselves like normal bone tissue.
Uh-huh.
So I would recommend like trying both sides, because one side for me felt different. Like there was a much heavier density to one of my bones than the other. And so I think that would also be interesting if you're, in the curious space of, hey, what does my bone tissue feel like? Of comparing your right to your left and saying, okay, what does my bone on my right feel like? What versus the bone on my left feel like? And I think, I mean, you're also a master of knowing very distinct small pieces of bone, what they feel like from each other. But for like general practice, I think it's good to just understand that like bone is dense and hard, and there might be something to it if the side that you're having a lot of maybe tension or pressure, like feel that bone and see what's going on in that bone nearby, because
Absolutely.
that could be telling us something.
Absolutely, and I mean, as you're feeling it yourself, you're gonna notice some tenderness often, and, I mean, the more impact or strain that a bone is subjected to, the more rigid it gets. It rigidifies, and this actually happened to my mom where she fell twice on the same hip in a short period of time, and she broke it, and this happens to people where if they have significant forces of injury on one particular area a couple times over, it is more susceptible to fracture. And so the bone does get more stiff and rigid. And so as a practitioner, if I'm feeling those areas subtly, it may feel a little bit different, but for the most part, the patient is going to feel more of the difference. They'll feel different sensations as I'm, say, prodding the bone. It's going to feel more tender or, like you said, heavy, or there's going to be some other nervy sensations as I'm palpating the bone.
And let's take a deep dive into nervy, because I think that's also a sensation that a lot of people don't know how to differentiate between. So how do you help people differentiate between when a muscle is under a lot of tension versus your nerve line is under a lot of tension? Because I think that also happens really frequently, is we just don't know what they feel like and what the difference is. So when we say, oh, I'm feeling this tension, I think the only thing that people know is they've heard the word sciatica. So I have a lot of tension behind my leg and in my hip, I must have sciatica.
Mhm. Yeah. I mean, if we're looking at, say, attention, which is also often associated with pain, like the difference
Yes.
between muscle pain and nerve pain. And when we have muscle pain, it feels tight and stiff or achy in that area. It's like heavy and dull, like something's just squeezing on it. And it's usually felt in one spot or region, usually in the muscle. And whereas nerve pain is more sharp and electric, it's tingly, it zaps, you know, it burns and it shoots down your leg. It travels along a line. It's not just in one spot. And so this is like the basic differentiation between the two. But I mean, generally, both tissues are affected in you could say an injury pattern or a strain pattern. And as far as matrix goes, we're looking at all of these tissues together. Yeah, I know we talk a lot about focusing on the bone and how that relates to the rest of the fascial network. But we are really looking at all of it. We're looking at the connective tissue, we're looking at the nerve tissue, the muscle tissue, and we're considering how all of these different tissues interplay. And so if someone is experiencing, say, sharp shooting nervy pain, I was like, all right, well, I know the nerve is directly impacted, but I'm not just thinking about, say, doing nerve flossing or stretching the nerve or trying to only look at that one region, say the sciatic nerve down the leg, for example. I'm not just targeting that one region because with my matrix hat on, I'm thinking global. So I'm thinking, okay, what other regions of the body are causing a compensatory effect on that hip and where is it coming from? And it was only a few years ago that I realized I don't have to worry so much about the pain that a person's dealing with. I just need to prove to myself and to them that I can improve their range of motion. I can improve their stability, so their muscle firing capability. I can improve their structural output, so actually helping to renormalize bone size. And if I can use these basically visual confirmations to confirm that I actually made a difference, the pain generally just goes away on itself, on its own. And this was a real eye opener to me because there's this saying, those who follow pain are lost. And this happens a lot in different therapies where it's like, I feel pain here. And it's like, yeah, I realize that. But, we're looking for where the origin of this pain is. And if we keep just working on that same pain area, basically we're lost as a therapist. And that's what I love so much about matrix repatterning. It really gives the practitioner the ability to figure out, okay, where are these strain patterns, these hidden underlying strain patterns that are contributing to this muscle pain or nerve pain? And what am I going to do to get to the bottom of this?
Which I think is the perfect opportunity for us to then talk about what it looks like to see a matrix patterning practitioner and what the assessment looks like because it's so different from being assessed in any other modality that I've experienced.
hmm Yeah, I mean, it's first person comes in, and of course we get the health history, and we hear everything that's happened to them, and we want to know what's happened to them. And then we get into a unique assessment process where we're looking first and foremost at the structure of the body, looking at how the bones of their body and the structure of their bodies is asymmetrical. And this gets to the point I just want to reference this, that in 2005 there's a team of doctors headed up by Dr. Paul Hansma from California actually. And they did a very interesting study in how bone reacts to forces of impact and kinetic input. And what they found was that bone tissue responds to these forces coming in on it by expanding. And to geek out a little bit here, there's proteins in between the bone cells, and these proteins react to kinetic input like a strain or an impact. They react to that input by expanding, and then it spreads all the bone cells away from one another, causing this expansion. And okay, well that kind of makes sense. Like bones swell, and people have heard of that, like muscle swell. But was what was fascinating about this discovery was that the bone didn't go all the way back down to its pre-injury shape, and size. So essentially, whenever we have a major impact or strain, our bones swell, so to speak, and then they don't go all the way back down. So we're left with a perpetually enlarged bone. And what's amazing about this is when you start to look for it and see it, it's like you've just been red pilled in the matrix and you can't unsee it anymore. So you see the reality before yourself. And this is what we're looking at first and foremost when someone comes in. We're doing a structural assessment, posture, and all that, but we're also looking at facial asymmetries. And I just saw a young lady last week where I started to assess her, and I have her sit on the table, and I'm just looking at her facial structures, looking at the symmetry, and I could see that her right mandible, her right lower jaw was expanded. And I just pointed it out to her. I took her phone, I took a snapshot of her face, and she just went quiet for a sec. And she said, I have known that for a long time, that my face has been like my jaw is pushed out that way. And actually I turn my face a little bit when people take a picture of me because I feel like my face is not balanced. It's like, it's more puffy on one side. And I was like, yeah, that's because your bone's bigger, and it just totally blew her away. And I just love being able to point this out to people. So when an assessment starts, we're looking at all these bone asymmetries, and we're using that as a clue to injury. Wherever there's a bone expansion is an indication that there's been an injury there. And then the next step is to run through a number of our assessments like range of motion, stability, specialized orthopedic tests, basically just getting all this information, taking it in. And at the end of that assessment process, we get into our bioelectric scan and
Can I pause you for a sec? Because I
go
think there's
for
one
it.
part that I think that Matrix does that no other technique does that I know is you also assess organs because when you've had a big impact injury, your organs also swell. Can you
Yeah.
talk more about that? Because I think affects way more people than most of us realize.
For sure. Yeah, yeah. I mean, as we talk about in the matrix world, the tissues that will absorb a lot of this kinetic energy from an impact or whiplash injury are the densest tissues in the body, including the bone and the fluid-filled organs. And obviously, all of the other tissues in the body get affected as well, but the denser the tissue, the more it gets affected. And so, when it comes to the organs, I like to use the analogy of dropping a water balloon on the ground. And what happens is the balloon will pancake or rupture. And so when we're in an accident, like a bad car accident, our internal organs are actually getting sloshed around. There's pancaking effect happening, and all of the fascia associated with that particular organ actually gets quite rigid, and there's some expansion that occurs in that dense fascia connected with the organs. Where this gets very interesting is how that starts to influence the functioning of the organ. So, for example, say you just had a big lunch and you unfortunately find yourself in a car accident, and in that moment, your stomach being full of fluid and food would do that balloon thing. It would expand and it would cause this fascial restriction in and around the organ and up into the diaphragm. And as a result, you can start to experience not too long after, or maybe it's a little bit later, maybe it's a year down the road, you start to experience digestive challenges in your stomach. You start to experience acid reflux. And this can be completely mechanically based. It isn't even necessarily dietarily related. And this same principle applies to the other fluid-filled organs which we target, the kidneys, and how that can affect blood pressure. And I've seen this with people where just treating the fascia associated around the kidneys, their blood pressure actually regulates. And same thing for cholesterol levels with the bladder and the uterus, dysmenorrhea, stress incontinence, constipation. I mean, the list goes on. We could talk about the heart and those functions. And I'd just like to say here that we're not treating the organ itself to like help these diseases or disorders. We're just normalizing the fascia associated with the organ. And a lot of the time, this really helps to facilitate better functioning in that organ. It's amazing.
I'll say from my own experience. So when I was in the car accident, I was in 2017. I was on my period and I had never had issues with that prior to. And then I started to have really painful periods. And it wasn't until I got to Matrix and got treated in Matrix that that really started to change and shift for me as we meaning Dr. Roth, worked on the fascial around my uterus. And he really helped me understand that that was a big catalyst was that that fluid filled organ was even more filled with fluid because I was menstruating at that time when I was in an impact injury. And so I think there's all these like pieces that it took me a really long time to figure out why I was it felt like all of a sudden I had this issue and it came back to that impact injury when that organ was more filled.
Yeah. Yeah, it really is incredible when you start to connect these dots. And that's often overlooked, in my opinion, is that you could have a mechanical origin to your physiological issue. It's like a lot of time we think it's something else, dietary, hormonal, stress,
Age.
age, those things factor in, don't get me wrong. But there often is a mechanical factor that gets completely overlooked.
We'll say that it happens because not that many people know about this, right? Like no one knows to see someone for this because it's not a part of our mainstream yet. Yet.
Yet, correct.
So no one knows like, hey, I could get help for this if I knew that it even existed, if this was even a thing to know about. So that's why we're here. We
That's
tell
why we're
people that
here.
this
Yes.
exists. Okay, so let's go back. We were talking about assessment.
Yes. Yes. So as we get through the structural assessment and we do ranges of motion and we're starting to put all these dots together, we can see these asymmetries. We get into the bioelectric scan, which is unique to matrix repatterning. And it is one of those, I think it's like a superpower, frankly. It's just one of those assessment superpowers that gives you such an edge to figure out exactly where that hidden strain pattern is. That's step one. And the bioelectric scan facilitates this. And so, if I can explain this as clearly as possible, if you can imagine, uh, I'm gonna the way I'll put this, Shauna, is I'll maybe have the person imagine, listener imagine that they're just on the table, right? And as you're laying on the table, one of my hands would be placed on your lower rib cage, just testing how flexible your ribs are, and that's your resting baseline tone. And with my other hand, I have the Matrix Mag scanner. It's a specialized form of technology that was received 4 double-blind studies and has also developed in Europe over 10 years ago. It is a therapeutic biocompatible device. And so I've got the Matrix Mag in my other hand, and my one hand's on your ribs, and I'm just monitoring how flexible the ribs are as I'm moving the scanner from one place to the next. And I'll start down in your ankle region. I'll start moving up your leg while monitoring the response at your ribs. Now, what's fascinating is as the scanner passes over an area, say in your shin, that's an injury site, the ribs become softer. Your ribs actually become more flexible. I can feel it with my hand and I can point it out to you. And what's happening here is that the scanner itself is inducing a normalizing current into your shin, which is injured. And it's temporarily normalizing that issue. It's masking that strain pattern. And your whole nervous system registers that change by relaxing, by changing. It's a biofeedback technique. Your body is feeding back information to me, telling me exactly where the problem area is. So this bioelectric scan is two-handed, and I'm always scanning with the one hand and always monitoring your body response with the other. And so as I'm scanning your body, as soon as I pass the scanner over a region that's an issue or a priority, my hand on the rib cage will let me know. It'll respond. And this is so amazing because as we talked about in episode number 1, figuring out where these hidden strain patterns is so hard. And using this scanning procedure, we can identify exactly precise regions of injury. Now, that's just step one, and we scan head to toe. We can scan the deep structures, we can map out structures, we can get a sense of whether there's an issue around a particular organ region. We can test to see if there's issues in the head and the neck. And so, as we're doing this scanning, we're looking at everything. Now, the scan itself gives us essentially a blueprint of what regions of the body are affected. And then, of course, that scan is going to line up often what we have seen structurally. So, for example, say I did scan and I saw a big injury pattern in the bottom of your head, kind of the base of your skull and in the upper neck. And I also noticed when I was structurally assessing your head that there was a big kind of distortion in your cranium. And maybe some of you who are listening have noticed this. Like my head feels like there's a dent in it, or it's kind of bulged out somewhere. Yeah, and this happens all the time. And so where we see these structural distortions, we'll also see an electrical disruption because it makes sense. If something's structurally distorted, then the electrical current can't pass through it evenly. So suffice to say, it's when you watch a video on this, it makes a lot more sense, but the scan is brilliant. And when practitioners get this, they feel like so empowered to figure out where these hidden injury patterns are. So that's the assessment. And once we figure out all these structural asymmetries, we get the baselines on your range of motion and stability. And we did this proprietary bioelectric scan. The last thing we do is we can prove to you the connections. We can actually show relationship patterns to you in your body before even treating. And I love this about matrix repatterning. And so if somebody comes into me for, say, low back pain, and I point out to them, hey, take a look at your multifidi, rotatory muscles, your deep little muscles next to your spine, and the low back, they're not firing properly. They feel mushy. I point that out to them. They're like, yeah, okay, I get that. It feels painful. I was like, this is part of the reason why your back is in so much pain is because it's unstable. And they're like, okay, yeah, yeah, yeah. I do my scan, I identify certain injury patterns, what we call primaries, in say the pelvis, the mid back, the neck. And then I'll go and place my scanners on those regions, mid back, pelvis, neck. And I'll go back and recheck their low back muscles, and they're suddenly firing again. I'll get them to do a bridge maneuver, lift your butt up off the table when you're on your back. And suddenly it doesn't cause pain, and they do it easily. And it's like what I just did there is I temporarily neutralized these key injury patterns that are directly impacting their low back instability. And this is
Can I pause
amazing.
you for a second
Yeah, go for
and
it.
point out something that I think is really important? I think a lot of us, because we live in a more Western based world, we think, okay, if I'm having low back pain, there has to be something going on in my low back. And what you're connecting in matrix repatterning is that it could be showing up, it could be presenting as you having instability in your low back, but it could be coming from more than one spot. And the likelihood that it's coming from more than one spot is really likely. It's not just that this one thing is off, it's that there's multiple things that are causing and I'm going to say accumulating. And that's what you're feeling is this symptom, but where these injury patterns are probably like are not close to where the injury is. That's just been my experience is the thing that you think it is where you're like it's low back, it must be coming from the pelvis, oh it must be coming from the hip, it could be coming from a shoulder, and it could be coming from an ankle. Like there's so many possibilities that it can be coming from that I think that's so far outside of what most of us would consider when we're thinking about our own discomfort.
Mhm. I agree. And the thing is, the ultimate difficult question is like, okay, I don't know where it's coming from exactly. So what do I do about this? And you read, okay, well, if your back's sore, well, you should work the front of your body and vice versa. And there's like the fascial trains. And I think a lot of people out there recognize the fact that the pain could be coming from somewhere else, but they have no idea where it's coming from, or they got locked into the scenario, like you just said, where it's like, well, I have pain in my low back. That's where the problem is. And so there's people in both camps. And so, I mean, it's true that the low back itself could have a localized injury, and you also will have more satellite injuries that are influencing the back indirectly. And I see that a lot. And the reason that I notice that people don't fully recover, or maybe their body doesn't respond to conventional therapies that well, is because all of these different elements aren't being addressed. So, that, for example, there could be over a dozen key strain patterns that are converging on the low back, perpetuating the issue. And until we get a handle on a majority of those, it just doesn't recover. And I've seen this with people where they have 6 different major primaries, different injury patterns contributing to the low back shutting down, and then contributing to that localized irritation on the disc tissue and the bony structures there, and they just can't crawl out of that chronic pain.
Yeah.
And so, yeah, I mean, being able to show the person in real time, hey, you came into me to have this low back pain worked on, but let me show you this. Your head or your face, this injury when you were 6 and you fell off the playground and hit your head on the ground, it is actually contributing to some of your low back instability. And that is what's continuing to drive your pain. I mean, people just feel so, I guess, what's the right way to put this? They feel relieved that okay, there's answers here. And in that relief, it actually helps them to recover greatly. And it's like a mental thing, dealing with chronic pain is a serious mental game. And if we can point out to them these relationship patterns and show them how this directly relates to their main issue, it's a game changer for the mental game. And I love doing that. So when we get through that assessment process, by the end of that assessment process, they have a clear picture on what needs to happen and where we're headed in order to get the results that they want.
And I think that I will say the other thing for me personally is that it's changed my nervous system as well. Like getting Matrix done changed. It felt like there were so many like tabs running. Like I'm so notorious. I have like 200 tabs open on my phone.
Yeah.
Don't ask. And that's sort of what my body felt like too, is that I had all these open tabs. And then once I received Matrix, it felt like a lot of the tabs were no longer there. And it felt like, oh, my body isn't trying to figure out how to be in space because all these tabs of all these injuries that are related that I couldn't figure out how they were all related. Just calm down.
Yeah, the way I like to talk about it is that our bodies, including our nervous systems, are burdened, like a serious burden. And when we go through a series of treatments using matrix repatterning, we're liberating the body from these old injury patterns. And the degree of lightness that people feel in their nervous system, in their tissues. They sleep better. They even feel happier. Many of them do. They say, I just feel better because we're liberating their body from this accumulated trauma that's compounded over a lifetime. It's very powerful. And so, yeah, I mean, that's the assessment process. We can get into talk a little bit about the treatment at some point if you want.
Yeah, go for it, please.
Yeah. Well, I mean, once we have the game plan and we understand what we need to do for the treatment, then the next step is to start to work with these areas. And the treatment itself is kind of a mind bender because you think if you're working on bone, you gotta like pummel the body. It's like gotta get down there deep. I mean, Must be really deep tissue if you're
Tissue
working on the
massage.
yeah, exactly. Must be really deep tissue if you're working on the bone, and it's not. It's extremely focused treatment. And what I explained earlier is that we use this bioelectric scan to figure out exactly which region of the body is affected. And then the next step is to figure out, okay, how do we engage that injury pattern? I know it's in the shin. I know this injury pattern is in the shin. What do we do next to engage it to release? And this is something that we call vectoring. It's incredible. When you understand how to vector the body properly, as we teach in Matrix Repatterning, you can figure out precisely how you place your hands and in what angle you need to press the tissue in order to facilitate that release. Now, the vectoring process tells you exactly how you need to treat the area in which angle, which is fascinating when you start thinking about it. Because when we have these injuries, say a fall in the butt, the kinetic energy is going to pass up through our tailbone into our low back. It's going to distribute in different directions. Maybe we twisted our ankle. Well, the kinetic force is going to kind of move in maybe a torqued or a spiraling direction through the tissue. So you have all these, I like to call them injury tracks, kind of like a helix, like a spiraled injury train track through the body in these different directions. And unless you engage that track specifically and accurately, you won't release it.
Right. So, like, I think the simple version is like if you like go back to your physics from high school, if the force was going up, but I'm treating it at a diagonal, it's not going to treat it. Like if the force was up, now I as a practitioner, I need to figure out the force on the bone was up and then I need to figure out how to do the opposite.
In a sense, yes. And also the other thing to keep in mind is as these forces pass through the body, the shape of the tissues, like the shape of the bone and the structures dictate how it moves.
Yeah.
And so that can also affect things. The density of the structure in that region can influence the movement of the kinetic energy through the tissue. But yes, being able to identify exactly how we engage the structure is totally game changing. And that is starts to create the results that you want. So once we figure out what we need to engage, say at the lower shin, at the ankle, in this manner, we start to compress the body. The person's totally dressed, they're in comfortable yoga wear or sweatpants or shorts. And what we're doing is we're using both hands to engage the structure, adding a moderate amount of pressure as we compress the tissue and we hold. So it's an isometric compression that is held for about 3 minutes. And something amazing happens in the first 30 seconds. A response in the tissue that is not only unique to the body, but what's seen elsewhere in nature, called this piezoelectric response, starts to occur. So piezoelectricity, uh, let me just break that down a little bit. So piezein is the root there. It's Greek for squeeze, and piezoelectricity is this principle whereby if you squeeze a certain substance, you can actually generate the movement of current through that substance. And in science, we understand this with crystals. Quartz crystals are used and ceramics are used. But in the body, bone and collagen are highly piezoelectric in nature. And this is incredible because if you compress the body, just 30-second hold, just that alone, it's going to start to generate this response whereby the tissues will actually start to generate electric current and it will start to move through the body. Now, if you can utilize this piezoelectric principle and target specific unique injury tracks like we just talked about, the vectors, that's where the magic happens right there. The actual reset of the bone occurs. And before I talked about how the bone expands and it doesn't shrink all the way back down because these proteins in between the cells are uncoiled. When we engage the body with this pressure, with treatment, we call it containment. It starts to generate this piezoelectric response. And this response begins to stimulate those proteins to reshape back down to their pre-injury configuration, which allows the bone cells to approximate, which makes the whole bone shrink before your eyes. It seems unbelievable, but when you see this for yourself, you'll be a believer. And it's incredible. You can shrink someone's bone within a matter of minutes. It's been locked in an expanded state. The tissues are just rigidified. All they need is the right stimulation at the right angle, utilizing this principle of piezoelectricity. And when the bone goes back down to its pre-injury shape and size, all of the surrounding fascia is way happier. in your leg, say you just shrank the tibial shaft, all of the surrounding tissues, the tibialis anterior, the calf muscles, all of these, even higher up, it all relaxes. And because the muscles were, in most cases, they were just tightening and irritated in response to this underlying bone tension. And then when we take that a step further and we think about how everything's connected in the body, if we release this one bony expansion, this deep core injury pattern, it actually affects the whole network. And so this is where you get this liberation effect. By just treating the legs alone, you start to notice the shoulders start to move better. Their posture's improved. They start to breathe easier. The rib cage starts moving better because when you treat one area of the body, you treat everything. And this is the beauty of Matrix. It's so precise and gentle. And this is essentially the treatment process. We'll move from point to point, only treating the areas that show up in the scan. So we're not arbitrarily treating. We're not guessing what we treat. We know exactly where to go and how to engage it and release it in a gentle manner. And I'll say this: when I first started receiving this treatment personally, I was amazed at how relaxing it is. And it's like a supremely therapeutic technique, like amazing on that front, but it's also very, very relaxing. When you're on the table, you feel like you're getting sedated. And so it's this beautiful combination of superior relaxation and amazing therapeutics. And so as we get through that treatment process, it could be 30 minutes or an hour, we go back and we recheck the person's range of motion or their low back stability. And we're looking to see whether we have actual visible improvements in their function. And we often see this. We'll see bony size changes. So their leg length, their structural leg length corrects. We see shape changes in other areas of their body with different bones. We'll see range of motion improvements. We're going to see stability improvements. You can see neurological improvements. If you're running neurological tests, you can actually see neurological deficits reverse, and for example, their reflexes correct. Babinski's sign corrects. I mean, the stuff you just wouldn't think would happen happens, and so it's incredible.
I think what's so interesting is that I think in our culture we think that if you're gonna make change, you have to cut. Like
Uh,
if there's gonna be some sort of change in muscle or how your face looks, structure, or I think our general philosophy is okay, it's gonna involve a scalpel. And I think this is one of the only techniques, at least that I know of, that creates permanent change to structure and tissue without surgery.
mhm. Yeah, yeah. I mean, if you can avoid surgery, and I think most surgeons will agree with this, then that's better. Like surgery sometimes is required, but it's usually the last thing that is really considered. And yeah, I mean, we've seen things occur where you just wouldn't believe it. For example, a person comes in with moderate to severe osteoarthritis, and they start to recover in a way that you wouldn't believe would be possible. And so for those people, this happens a lot. I haven't been able to help everybody in this regard, but a number of people have postponed or canceled their surgeries because they didn't need to go back. The doctor's like, oh, you know what? We don't need to do the surgery right now. You're okay. Whereas some people they're too far gone. There's maybe more complex factors that are contributing to the breakdown. Then they need to go get a surgery. But I've been continuously amazed at what's possible. And yes, if we can correct things or help facilitate healing without the need to cut or to saw, then all the better.
Okay, I as we're talking, I wanted to ask you, and you could defer, but I know that a really common injury here is athletes tearing their ACL, which is in the knee, or tearing some sort of ligamentous structure, or that's what they're diagnosed with. Is it's a tear of a ligamentous structure, ACL, PCL. And I know when Dr. Roth was at our last class, he said, when they go in and actually do surgery and look at it, most of the time those structures are actually still there. They're still attached. And so when they go in and do surgery, there's a high percentage that the ligament is still attached and that was not the issue. Can you talk about that? Because I think that's such an interesting case and
Mhm.
point of what is the underlying factor versus what we think it is.
Yeah, that's an interesting one. I think perhaps what's going on there is there might be adhesions or scar tissue. There's something's going on there, some confounding factor in the imaging. It looks like a tear, but when they go in and do investigative surgery, it's not a tear. It's more, in some cases, I should say, it's fascial adhesions, and they may do like a separation. They kind of like just separate some of the fascial tissues. And that's as far as I know what's going on, what I could speak to in terms of that. Now, why is that happening? Well, the ligament itself isn't the prime stabilizer. It's the musculature that surrounds the knee, for example, if we're talking about the knee, that maintains second to second stability. So, for example, the popliteus muscle in behind, the medial hamstrings in the front, they are monitoring and maintaining second to second stability. So I think people are, a lot of the time, athletes are chronically unstable and they are micro traumaing, if I can say that,
Yes.
their knee, and they don't realize it. And this could very well be setting into motion scarring or adhesions, some sort of factor in the tissue that is creating these imaging findings that the doctors are seeing. And the fact is when they go in and do surgery and they don't have, it's like not a tear, it's not completely torn off. They don't need to really do anything to it. They just say go do more physio, do these corrective measures, provided they don't have to do any sort of internal work. Then what we're dealing with is a situation where we need to get to the underlying cause behind their instability. And I think a lot of us are dealing with that chronic, unknown instability, creating this microtrauma day-to-day basis. Yeah,
Can we talk about what a normal joint feels like? Because I think, ha ha ha,
yeah,
let's lead it in because I think that's such a big misnomer, and I think the sort of we'll say like basic thought is well, most females are hypermobile. They have more joint mobility, and most males are hypomobile, or their joints are not as they're not as flexible. And so, yeah, I wanted to ask you, like, what does a normal joint feel like? Because I don't think most of us even know what that feels like.
yeah. I suppose it fluctuates. I mean, based on gender. I mean, if we cover the male female thing, females due to hormones like estrogen, which can essentially create a bit more softer, stretchier response in the connective tissue, so that could contribute to things. Sometimes a woman will inherit hypermobility or extra movement. And men, on the other hand, are the higher testosterone promotes muscle mass, denser connection. It can make the joints a little bit stiffer, less pliable, but it's not a hard fast rule. Like, I mean, personally, me, I'm actually hypermobile, so it doesn't work for everybody that way. But there is that kind of generalization that you do see, and I think it does depend on where the person's at. Like for a woman, where they are in the cycle, are they pregnant? What's the hormone levels like? What's the genetics like? But also, what are their injury patterns like? If we're thinking about it from a matrix standpoint, what's going on in their body that's contributing to perhaps chronic instability on one side of their body. So, for example, and I see this pretty often, you could have hip, knee, and ankle instability all on the one side, say right side, and it's being driven by a couple of main primary restrictions, so injury patterns in the thoracic spine or cranial base or even in the jaw. And when I go and treat those areas, all of that instability goes away. And so a normal joint is essentially it should be symmetrical in size to its neighbor. You should get good movement out of the joint, being able to bend it, extend it, twist it without pain. There should be some shift in the joint, but not so much shift that it feels like you're going to pop the joint out of place. And
Yes.
and that's what we're going for with a healthy joint, or what would say a normal joint should feel like.
Thank you.
Yeah.
I just don't think most people even know. And I feel like I didn't know until I got injured and then realized what normal joints felt like. It's not something that we generally think about or conceive is what do our joints feel like?
Yeah, I guess when they're in pain, you start to think a lot more of your joints.
Yes.
And so there's often inflammatory reaction within the articular surfaces, the surrounding tissue, the attachment points for fascia and muscle. I mean, it's all connected. So yeah, the joint is of course going to be influenced by surrounding tissue and vice versa. So that's what's amazing about looking at the body as a unified being is that all areas, all things connect into one another. And so if there's a joint issue, I'm thinking, okay, well, there's got to be fascial, muscular, neuromuscular issue, maybe an internal organ fascial restriction pattern. And by normalizing those things, we can see the environment heal up around a joint in that region and finally kind of get back to what we were when we were younger and healthy.
I know Matrix has a lot of really interesting and unique theories. I know you shared some of them, but is there another theory that you've learned through Matrix that you'd like to share that doesn't get a lot of press?
Different theories. Well, let me see. Do you mean things that only matrix practitioners know about, or like,
Yeah.
good?
Tell us the secrets.
Tell us the secrets.
Spill the beans.
Well, here's one, and I've seen this enough times. We talk about, so in Matrix, I've talked about this piezoelectric response, which is that when you press on tissue, you will engage an electrical response in that tissue, specifically the bone and collagen, and you can shrink it. So we just talked about that earlier, right? But the reverse can happen. If you have electrical input on tissue, you can make it swell. This is the reverse process. So what I just explained earlier is you can compress tissue and cause it to shrink using the piezoelectric response. But then you can reverse the whole process and input electrical current and cause the tissue to swell. Now, where this is very interesting is if you think about how different injury patterns in the body will actually feed electrical current into a particular region and cause it to swell. And we talk about this in Matrix, where an injury pattern in the head is like an electrical generating irritant. It's just putting out all this electrical charge and it's feeding down in the body. And it's actually causing the lower limb, which you're trying to treat, just cause it to continue to swell. The bone doesn't regulate. Okay. Where things get interesting even more is when we think about how our thoughts and our emotions start to interface with our body. And therefore, if, say, you're super stressed out or prone to anxiety or anger, I believe, anyways, I'll speak for myself, and I've seen this with clients, that this can cause a structural change or manifestation in the body. And so that's something that other people have talked about, like Dr. John Sarno, the guy who wrote Healing Back Pain.
Mm.
He talks about this, about how our emotions can affect our physiology. And it's amazing to think about how our thoughts, how our emotions can directly affect our physiology, our structure. And that is something that I see with my work, and that is talked about in different circles for sure. Peter Crone, he's a guy from California. Love his work. He talks about, yeah, he's great. Dr. John Sarno, different people like this. They talk about how our emotions and our thoughts directly influence our health, and I see that directly in my practice.
I feel really called out right now. Thank you, Oliver. No, I think that's so true. And I think a lot of times, and I guess this is me speaking for myself, is when you've had an injury and you've seen lots of people and you feel like, okay, I'm telling everyone that this is an issue and no one can figure out what the heck is going on. It makes you feel one, like you're delusional, or that that's not reality. And then I think that even compounds the stress of the injury even more, because now no one knows what's going on and no one has an answer for you. And so then I think that only adds to the pain and the instability and the structure. Like it all becomes this big thing
Yes.
that has kind of created its own world within itself.
I agree. And we see this in practice where we'll just do the assessment. I've done this a number of times. Just do the assessment. I show everybody these new things, like I said earlier, but this young lady who, I showed her jaw was enlarged and she's like, no, like, I always notice it, but, and I was kind of embarrassed by it, but I didn't know what to do about it. And you point out these things and then you show them the relationship patterns and then you show them the way forward. And that is so relieving and supportive. They feel confident in your ability to really move them forward in their treatment plan. And because their mind can see the connections and see the way forward, I think it greatly improves their recovery because the mind is so important in this process and the emotions impact our health so much as well. And this is part of the side benefit of matrix repatterning is that by showing people these connections and the way forward, that mentally and emotionally they feel so relieved that they can have a tool and support that can help them move forward in their healing journey.
I wanted to ask you because I know you all at the Matrix Institute are great researchers and you do a lot of data on yourselves through your own practices. You do a lot of peer-reviewed studies. You guys are really on the forefront of research. What's other secrets? What's the new thing that you guys are working on or looking at?
Well, I'm not directly connected to the research part of it. Dr. Roth in the last year has been using a device called the Neural Catch, which is like a specialized helmet that goes over your head and is able to
Mm.
monitor brainwave patterns. Super cool. And by using the Neural Catch and monitoring the brain's response to EMFs and potentially treatment, but that is something that you'd have to reference the institute directly on. Something that we have talked about because we haven't, doing a proper peer-reviewed gold standard study is it's millions of dollars,
Yes.
and we can't do that. We're a small institute.
But mighty.
Pardon me?
Small but mighty.
Small but mighty. Totally. You got to start somewhere. But those kind of studies are very expensive. But what we have been talking about recently is getting a number of the CMRPs, the Certified Matrix Repatterning Practitioners, to all work on a specific case
Mm.
and to case studies on mass, essentially. And so if we can have, say, 30 CMRPs do a case study, which means we treat these individuals a number of times, and all these individuals have one particular issue, whatever that might be. And that could be, say, chronic low back pain or uh, upper cervical instability, whatever. One of these things that is well understood and recognized in the scientific world. And that is something we were working on. It'll probably come down the pipeline in the next year or two. And I think that would definitely increase the credibility of the therapy. And it's something, to my understanding, something that the chiropractic world does a lot, where they'll do these large scale case studies. And then you can use that information to gain a little bit more credibility within your approach.
Yeah, the physical therapy world does that as well. So I'm excited that you guys are going to be doing that as a part of the next phase forward. Is there anything that I haven't asked you that you'd like to share?
Yeah, there was something I was thinking of. Things that are new. I guess this kind of ties in to what you were just asking, but
No.
a couple of new things on the street. Just recently, a couple of PTs, one Canadian, one American, held an online info session. It was a knowledge share, 2 hours long on LinkedIn, and they talked all about how to use Matrix Repatterning to offer a specialized help to physical therapist patients. So you guys, the physical therapy world, and specifically revolving around joint instability. And so we are planning more of these knowledge shares, and we're reaching out to the PT world, specifically in the States. And we're connected with some people to help us connect into that community. And so what's exciting about this is PTs down in the States can start to access this content for free. It shows them the basics of Matrix and how this could help improve their outcomes with their patients. And so that's one thing I wanted to mention. And yeah, they can look for Natalie Roche, actually, if I can drop Natalie's name, if people are
Yes.
interested. Yeah, Natalie, and then Roche is Richer on LinkedIn. Natalie Roche on
I'll
LinkedIn.
put it in the show notes.
Okay, cool. She's going to be holding more information, knowledge shares in the future. The other thing that is really cool, it's coming down the pipeline, is Dr. Ross working on a second edition of Matrix Repatterning Self Care Program, so a practical workbook
Yes. Yes.
to
Yes.
use
I'm so
Matrix.
excited about this.
Yeah, yeah, yeah. So, to use Matrix at home, and for anybody who's not a practitioner and is listening to this and is wondering, like, okay, how can I do this for myself? That's going to be an amazing support for people. And the other thing I want to say is that we've been refining and streamlining the programs, because I sit on the educational board. We've been improving the program and making it easier for people to enroll, and the program is like the best it's ever been. And so if people are really interested, practitioners like PTs or other practitioners like chiropractors or NDs, naturopathic doctors, are interested in checking out what Matrix is about, you can go to matrix4practitioners.com.
As well.
Yeah, thank you.
I want to go back to when do you think Dr. Roth is going to have that second edition?
I don't have a solid date on that.
Okay.
Yeah, but I think
I'm really excited about it.
I know. I think he puts his mind to it and gets it all the things he wants to cover, probably not longer than 12 months, I'm guessing.
Okay. Okay. Well, maybe I can convince you to come back on and when it launches and we can do like a special little launch for it on here. Cause I would love more people to know how to help themselves. I think that's one of my big goals with this podcast in general is how do you help yourself? How do you know how to help when there isn't help around?
Yeah,
And how do you know how to ask for help when it's beyond your skill set?
exactly. And I love that about what you do here. And I really like that idea of getting back together and talking about like the Matrix self-care program or Matrix first aid.
I would love
Yeah.
that.
Yep. We'll
Okay.
we'll definitely do that.
Okay, good. Please plug anything else Matrix related, yourself related. I know that you're not close, but if anyone is in Canada,
Yeah, I'm like on a small outpost in a small little tiny little community. But yeah, people
you want to
want
get in a horse and buggy and go
yeah,
see all of
it's not that bad. Get on your skis and just ski up here. But yeah, if you want to check me out, you can go to oliverhartan.com, Oliver Hartan.com. If you want to learn more about me and what I do, you can check out Matrix Repatterning if this really piques your interest and you want to learn more about Matrix Repatterning, find a practitioner in your area, go to matrixrepatterning.com. That's your place to go. And that's it. I love connecting with you, Shauna, and having these chats. I think Matrix has something to offer here for people. And the more we talk about it and share, the more people are going to learn about it.
Thank you so much. I wanted to say one more thing about Matrix that I think well, it just crossed my mind is I think a lot of people who've seen, and I don't mean this in a negative way, but people who have done techniques that are like, I'll call it heavy handed, where someone's like really like gotten into the tissue, where you feel like the only way forward is to like really compress your tissue or get adjusted. And I do all of those things. Please don't get me wrong that I don't see a massage therapist, I don't see a chiropractor, but I think there's certain things that you can't get to with force. And I will say, my friends who are more sensitive like me, this has been a game changer for just doing other modalities because it's not a force driven modality in the same way other techniques are.
It isn't, and that goes back to why it's kind of a mind bender for people. It's just one of those very interesting approaches. And the analogy I like to use, because I like to talk in analogies, is that wherever we're most efficient in life, we're probably way more at ease. And you can see this with anything. If you play a sport, if you play an instrument, if you do a trade, you're not straining in the same way when you become very easy and accurate and elegant in the approach. It's just smooth, easy, and that's the way of Matrix. It's just a very elegant approach that is pinpointed in the fact that we can find out exactly where we need to press. Then we don't need to press hard. These strain patterns they're almost like spring loaded. You just need to figure out where the release latch is, and by just releasing that latch by a little bit of compression that we call containment, that facilitates the reset. And it seems too good to be true. It seems too easy, but it's that way. So whenever things aren't working, just try go lighter.
And that's so hard for us as humans.
I think it's hard. Yeah, it's probably an ego thing where it's just like in German, there's this saying called Mitgewalt, which is like with force, just like, just Mitgewalt, yeah, just power through. And I like this. Have you ever been on the beach and it's like wet sand and you're just running on it? It's hard, like boom, 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 hard, right? But then you stop, and you just like wiggle your heel a little bit, you just sink straight down into it. That same response exists in the body. It's like this pushback response. And I think there's a technical term for it. The fluid in the tissue response is such that if you go quick and hard into it, it will push you back. But if you just rest and you wait and you coax, just like your heel on the sand, you drop right in and you go so deep. That's the thing. When you're running on the sand, you're on the surface pounding, but you stop, you give a little bit of pressure and a little bit of a wiggle, and you drop in deeper than you were when you're running. And that's kind of the same thing that you can do with treatment, with light treatment, if you know how to engage the body properly.
That's such a beautiful analogy. Okay, I'm borrowing that. I hope you don't mind.
I don't mind at all. Go for it.
Well, thank you so much, Oliver. We're putting a pin in this, and he'll be back when we have this part two release, and we'll bring you into the world of matrix repatterning that you can do in your own home. Thanks so much, Oliver.
You're welcome. Thanks for having me, Shauna. I love these conversations. I look forward to the next one.
Agreed. I'm going to close this out.
Okay.
You've been listening to Authentically Shawna with Dr. Shawna Burke. The information contained in this podcast is provided for information purposes only and is not intended for the purpose of diagnosing, treating, curing, or preventing any disease. Before using any products or techniques referenced in this podcast, consult your healthcare provider. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. Thanks, and we'll see you next week.